All right. Well, first of all, thank you for, staying till the last seminar. I know it's not easy. I know, kids are back from school. We got to go back home and everything. So thank you for making it so far. I know we're just a few of us, but hey, maybe that's an advantage for us as well. That gives you more freedom and more time to ask all the questions you want. Consider it a free consultation with a therapist, so you can have the freedom to ask all the questions you want at the end, or if you want to interrupt me, also feel free to do so. Okay, so I'm just gonna leave the microphone here in case it's closer for you. So, my name is Liz Hajj Nicolas, Liz Hajj Nicolas, and I'm a speech and language therapist. I'm the supervising therapist at Developing Child Center. Okay, and today we're gonna be talking about voices of our kids, okay, they're the voices of the future. We're gonna empower their plurilingualism and bilingualism, and we're gonna talk a little bit about the speech therapy stigma that we have in the Arab world and how can we overcome that, okay? So we're just gonna go quickly through the agenda. I'm not sure if you've been here all day, if you maybe have a bit of an idea of some of the topics that have been discussed, like bilingualism and, Arab language in general. Do you both speak Arabic? Yeah. She doesn't, but no, but in case you felt free, you wanted to ask anything in Arabic, please feel free to do so. So we're gonna understanding what plurilingualism is. Okay, we're familiar with the term bilingualism, so today we're gonna take it a step further. We're gonna talk about specificities of Arab children in speech therapy. Okay, what makes a speech therapy session different with an Arab child? What is speech therapy? So that's a very important question to start with. Some developmental milestones, communication developmental milestones, and feeding developmental milestones, and we're going to talk why in a bit. When to refer to speech therapy, the benefits of early intervention, and lastly, we're going to talk about some strategies to address the stigma that we have around speech therapy in our Arab world. And we're going to have some questions and hopefully some answers to those questions as well. Okay, so first of all, what is plurilingualism? We're quite familiar with the term bilingual, so we're talking about bilingualism when we speak and understand. Please come in. Thank you. Okay, so the term bilingualism is speaking and understanding, and it's important to know that it's not just speaking a language, it's also understanding it at two languages. Multilingual is 3 and more languages that I can speak and I can understand. Plurilingualism is also when we're talking about 3 languages, but it's more the fluidity while using the languages. Hi, kifak sava is a typical Lebanese sentence. This is more plurilingual than multilingual, then we're just using Arabic in a specific context, English in a specific context, or a third language in another context.
So do you mean like when we blend?
When we blend, when we mix them, when we are like more fluid in using the languages rather than sticking to one language in one context, okay? So we have some myths about plurilingualism and with our kids. I often hear that they cause or worsen speech and language delay. This is absolutely not true. It's a myth, that's why it's not true. So actually, in a lot of times, speaking more than one language can cause a bit of delay in the development of vocabulary in a certain language because you're already developing vocabulary in another language. But at a certain age, kids will pick up at both languages, and either they will have a richer vocab than monolingual kids. Okay, so definitely it does not cause speech delay at any cost. Children with speech delay should focus on one language only, and this is also another thing I hear a lot in my clinic. Parents come and they're like, he already has speech delay, I'm just gonna stick to English because this is what he learns in school, so like there's no point in introducing Arabic or introducing Russian or introducing whatever native language they speak at home. This is also a myth. You should encourage definitely the mother tongue, especially the mother tongue, because you're depriving your children from cultural experiences, chances to talk to teta and jiddo, chances to talk to their cousins or people who do not necessarily speak English, just for the sake of that, he has speech delay. If anything, bilingualism or multilingualism actually develop more the brain areas that are responsible of language and communication of the brain in the brain. Tell me. I'll get back to you on stuttering in one of the slides. Okay, thank you for that question though. Keep it in mind.
And forms of stuttering.
And forms of stuttering. Okay, we're gonna switch the topic to stuttering then. Okay, luckily I'm a stuttering specialist, so I'm here to answer, and there's a lot of people, so I'm here to answer all your questions. Plurilingual children will never be as fluent as monolingual peers. I speak English, بحكي عربي، أتكلم اللغة العربية، je parle français. Obviously, this is not a rule. Most of us born speaking at least 2 languages, if not 3 languages or more. So this is definitely also a myth. Now, the benefits of plurilingualism, we're going to talk a little bit about the cognitive benefits. So we have what we call cognitive flexibility or mental flexibility, because we're constantly switching from one language to another. So we have a higher developed cognitive flexibility, which also helps us a lot in, we're going to talk a little bit also about the academic performances. When we're trying to solve something, when we're trying to plan something, all that mental flexibility that we have due to our language development will also help us in daily life tasks. Memory and attention, obviously, because we are memorizing a wider range of vocabulary, the attention to know when to use what language and when to switch and all of that. Metalinguistic functions, so when we're talking about metalinguistic, this is actually something that I wasn't aware of until maybe 4 or 5 years ago when I was, well, I'm a speech therapist. I don't teach the Arabic language, but I was in some kind of program where I was learning a language and teaching a language for someone. So I was learning Norwegian and I was teaching someone Arabic, Lebanese specifically. And I was giving her an example. She's monolingual American. She speaks nothing but American, not even English, not even like British English, like purely American English. And I was giving her an example about, tenses or like ing form or whatever. And in Arabic we have the patterns, the roots, the maf'ulun, we have specific ways of building that language. And she was like, I have absolutely no idea what you're talking about. I was born speaking the language and I just speak it. I don't think how I speak the language. And maybe if I spoke only Lebanese or you spoke only, where are you from? Lebanese, okay, so, or spoke only one language, we wouldn't necessarily think how we're forming the language that we're speaking. But having access to different languages as well kind of makes us more aware how a language is formed from a grammar way, from a phonological, from a syntax way. All of that makes us more aware about the language itself. And then finally, the executive function. So the frontal lobe of the brain is responsible of all the executive functions. So we're talking about planification, we're talking about inhibition skills. So I'm talking to you and suddenly I want to switch to someone who doesn't speak Arabic. I gotta inhibit the part of my brain that was speaking Arabic and switch to English. So this is inhibition skills, working memory, all of that. And we're still just talking about the cognitive benefits. We move to the social benefits, obviously communication skills. Kids who speak multiple languages, they usually have more confidence. Hello, thank you for joining us. They have more confidence in public speaking or speaking in general in front of people. Empathy and perspective taking. I think we talked a lot today about how speaking bilingual or having bilingual development or multilingual development makes us a bit more aware of the culture and the history of the other person who speaks the other language. So that definitely by default makes us more empathetic and we take more perspective of other people because we have that exposure. Now, whether it was because, colonism or whatever it is, but we are more sympathetic towards other people, especially us Arab. For some reason, we switch to English and we switch to French. Us Lebanese, we do that. When we're speaking to someone from Egypt, suddenly we switch to Egyptian for some reason, although we can speak perfect Lebanese, And finally, social integration, knowing that the other person speaks a language that you also master, gives you an advantage to go towards them, that icebreaker, actually initiating communication and all of that. And finally, we're going to talk about the academic benefits. So kids who speak 2 or more languages also research have proven that they have a higher academic performance, especially in subjects that require, let's say, mental flexibility, problem solving, all the things that we talked about in the cognitive benefits, math, science, all of that, they have a higher achievement. And finally, global opportunities, and I think we wouldn't all of us be in Dubai if we didn't have that. Speaking multiple languages allow you to work in different contexts, different countries, and open a lot of global opportunities for you. Now, specificities of Arab children in speech therapy specifically, okay? So when I receive a child who's Arab, first of all, the assistant will tell me there's a new kid, he speaks Arabic. The first question I ask them, obviously, what Arabic? Because if he's Emirati, he's not the same as he's Lebanese, especially if that's his first language. If his first language, which unfortunately we see in a lot of cases, the first language is English or whatever other language, and then the second or the third language is Lebanese or Emirati or Egyptian or whatever it is. So we have a lot of specificities for Arab children that I usually talk about or discuss during the initial consultation with the parents. So first we have the concept of plurilingualism that we just talked about. What are the languages that the child speaks? And I need to know the level of mastery of each language, because if the child first language is not a language I master, automatically I refer them to a speech therapist who speak that language, because it's not fair to the child to be assessed in a language I don't speak. If they come, I don't know, they speak German and English as a second language, I cannot just assess them in English, because I'm disregarding a big chunk of the vocabulary they have, the grammar, everything that they might also be exposed to, and I wouldn't have like a fair results in their assessment. Then we have the dialect variations. Random one, what is that? Okay, then we have the dialect variations. We've been talking about dialects as well today. Again, I asked them if they are Emirati, if they're Lebanese. If it's something I'm not comfortable with, I also refer, okay? And then we have the concept of diglossia, and this is the difference between modern standard Arabic and the dialect that we speak. Yes, so our children, they are bilingual even if they speak only Arabic, okay? Because they are exposed to modern standard Arabic and they are exposed to Lebanese, Egyptian, whatever it is, before even being exposed to English and all the other languages, okay? So you can just imagine that poor kid, not poor kid, actually, they have a lot of advantages, but the amount of information they have to, keep up with. Then we have the social factors. So we have very particular, let's say that's what's happened when you talk about family. Okay, we have very particular family dynamics in our Arab countries and community practices. We are very, family oriented. We have the teta and the jiddo and everyone raising the child. We say it takes a village to raise a kid, right? We might not have that as much here in Dubai. Teta and jiddo are not maybe around, but somehow we find a community of Arab people around us. So we always have the influence of that community in the raising of our Arab child. And we have something that is not always as positive, which is the occasional replacement of main caregivers. Unfortunately, in a lot of times when the child comes to therapy, I sometimes don't even meet the parents. It's the nanny or the driver or anyone else replacing the main caregiver, bringing them to therapy. So this is something very specific to Arab kids. I don't face that with any other ethnicity, let's say. And then we have the economic factors, which is kind of a double-edged sword, because in the UAE we have people who are very comfortable, let's say, financially, and they can provide everything the child needs, but we also have Arab countries where they do not have as much access to educational support and resources and all of that. Then we're going to talk very quickly about the political factors, because as Lebanese I try not to cry today because I've been doing that a lot today. So we have the impact of political instability. And speaking of stuttering, after the Beirut explosion in 2020, up until I would say 2022, I kept receiving kids who post-explosion developed stuttering, and we cannot just put the political part on the side when we're dealing with kids. They absorb a lot of things, and we end up receiving them in therapy, whether it is speech therapy or psychological therapy, or in school or wherever it is. And lastly, we have some cultural factors that are very specific to Arab children as well. Unfortunately, we still have a lot of stigma around therapy. We have a lot of myths and misconceptions that we're going to talk about in a bit regarding speech therapy specifically. I said speech therapy maybe like 80 times by now, but what is actually speech therapy? So I actually wanted to talk about the definition, because a lot of people think that speech therapy is just for treating articulation and the lisping and my name is Liz and all of that. This is actually just maybe like 5% of what we do. This is the fun part of our job, but we deal with a lot of other things other than just the articulation part. So it's a clinical intervention that focuses on assessing, diagnosing, and treating speech and language. And these are two different things, okay? And I'll tell you the difference in a bit. And communication, which is another different thing, and feeding disorder. So basically anything that has to do with this zone is kind of for us to deal with.
But what's feeding disorder? Like, what do you mean by
I'll tell you in a bit. Okay, let me just finish that sentence. I'll explain all the different points. And we work with children and adults, which is another misconception that we only work with kids. They're the cutest, but we also work with adults as well. Usually when, let's say, we have post-traumatic brain injury or after a trauma or anything that might, Alzheimer's diseases, strokes, anything that might affect the brain and might affect communication, and whether it is expressive or the understanding, because sometimes you see people after a stroke, they stop understanding the language. They might have also feeding and swallowing difficulties, and they insert a tube, and all of that. This is also part of the speech therapy, basically. So the difference between speech, language, communication, and feeding. When we're talking about speech, we're talking about the sounds that we're saying. Okay, so here we focus more on articulation, if you want. Okay, The language is more the vocab, the syntax, the grammars, and all of that. Communication does not have to be verbal. Body language is a communication. Expressions, facial mimics, all of that, that's communication. So a verbal part is one part of the communication. The feeding disorder is when we have drooling, for example, we have difficulties swallowing, we have difficulties chewing. All of that is also a part of it.
Loud noise when you eat like a problem, or is it just like no manners? Really, because really I have this problem with these kids, not my kids, but like specific kids, and it just bothers me.
Okay, so it can be a habit. So I'm not used to keeping my mouth shut while I'm chewing. But at the same time, it can be sensory disorder. So it can be that they're not hearing the chewing as much as you are, because you might be a bit hypersensitive to that, which is also another case. But also, some kids require more stimulation on certain sensory levels. Auditory one is also one of the sensory needs. So they might chew louder, they might speak louder, they might toe walking, for example, is another form of not hypersensitivity, but needing to be stimulated a bit more. Because when you're walking on your feet, for example, like that, you're getting a certain amount of stimulation. If you're walking like this, you're getting more pressure. So they seek that toe walking, for example, for more pressure and more sensory input.
Makes a lot of sense. I guess it is sensory because they do speak really loudly as well.
It could be sensory for you as well. You could be like.
No, I'm not.
Okay, no, but people who are bothered by it, we should also ask ourselves, why are we bothered by these sounds? All of you. Tell me.
You're okay with questions?
Yes, please.
I just wanted to ask, when it comes to language, for example, me, I can read, write Arabic completely fine. My problem is I learned Arabic in 3 to 4 different dialects.
Okay.
So when I speak it, what ends up happening is my dialects are mixed.
Yeah.
I feel an overwhelming sense of anxiety while I'm speaking,
Okay.
depending on who I'm from. So I'm wondering, is this an actual disorder?
No.
Or is this just insecurity?
These are insecurities, and let me just tell you, it's beautiful when you're mixing dialects, and that's completely fine. It just tells us that you have more flexibility talking to the different people you have. If you're talking to someone Jordanian, Lebanese, whatever it is, you're just adjusting to them. And plus, this is how you, let's say, the input of language you had. So that's a mix of. It's like saying I'm mixing Arabic and English. Is it a disorder? No, it's just a richer environment of language. Now, if it makes you feel uncomfortable, it's probably because maybe you had like negative experiences related to that, but it absolutely is not a disorder. Please feel free. Yes?
So 2 questions.
Yes.
First one, because we talked about children who walk on their
Toe walking, yeah.
Yeah, toe walking. My nephew toe walks all the time. He's 2 years now.
2 years is still fine. 2 years is fine. Yeah.
But also I wanted to ask you something. Is it normal for a child who's 2 years old not to still like he doesn't speak? Is that normal?
Just give me maybe like 1 or 2 slides after this, and I'll get back to you. And by the way, I prepared like a QR code that you can scan at the end that has all the milestones that you might need, whether it is communication development from 0 to 6 or feeding development as well, so that you know that at what age they should be eating what, how should they be chewing, when is drooling still okay, when it's a disorder. All of that will be at a QR code at the end. Hi, you both are here. I'm so lucky. Okay, let's continue. So some of the pathologies we addressed in speech therapy, because I was like, speech therapy, so we're actually defining it. So we talked about articulation disorder, lisping. My name is Liv, for example. Okay, so that's an articulation disorder. Verbal language disorders, this is more when we're talking about phonological disorders. For example, a child who, again, at an age where it's not age appropriate anymore, they would say, for example, nanana for banana, although they can perfectly well say baba. Okay, so they can say the B sound, but in a certain order of sounds, they might switch to a simpler sound, and this is when we're talking about phonological disorders, for example. Written language disorders, so I saw a stand about dyslexia outside, so reading and writing difficulties, this is something also speech therapy would handle. Social and pragmatic skills. Anyone knows what that is? It's one of my favorite. Okay, so you have the vocab, you have the sentences, you have the grammar, but it's the use of the language, okay? Usually, but not in all cases, Kids who are on the spectrum, they have social and pragmatic difficulties. You feel like they don't understand humor. You feel like they don't have the right facial expressions when you're talking to them. Now I'm talking, you're listening to me. If you want to ask me a question, you would probably wait, I hope so, until I finish the sentence. No. But interrupting is no. Okay, now that sounds wrong now. But it's basically the social norms of having a conversation, respecting those norms, okay? Listening, turn taking, facial mimics, understanding humor, changing topics in the middle of a conversation. So this is what we call more social and pragmatic difficulties, okay? Executive functions, we talked about the frontal lobe for the people who were not here before. So planning, inhibition skills, problem solving, all of that when we have difficulties in the executive functions. Fluency disorders, someone talked about stuttering. So when we're talking about fluency disorders, we're talking about stuttering and cluttering. These are the two main fluency disorders that I'm gonna answer your stuttering question in a bit as well. Voice disorders, whether it is kids or adults. I receive a lot of teachers who lost their voice after, so many years of teaching and shouting and like misusing and overusing their voice. So we end up with like hoarseness in the voice and all of that. So this is where we talk about voice disorders. And the last one is the feeding and swallowing disorders. So whether it is for kids who basically, since they're born, if they're having difficulties breastfeeding, this is where speech therapy starts.
Is it related to tight tongue, for example?
Tight tongue is a part of it, but usually tight tongue would affect feeding and articulation disorders. But I think we over-diagnose with tight tongue sometimes. Sometimes, like if it's not completely tying the tongue, because there are levels of it, we don't actually like do the surgery or we do anything. We just do some stretching exercises to the tongue, just like you go to the gym and work a muscle. The tongue is also a muscle, and we end up like stretching it, and then that will allow us to feed, to chew properly and to articulate properly. حسب شو عملت مشاكل يعني إذا
ما عاملة مشاكل بس إنه over diagnosed.
إذا ما عاملة مشاكل, if it's not causing any difficulties.
So I can tell her that.
But why is the mom panicking? Usually moms have like a good, instinct as well. So you need to check, why is she panicking? Is the child's feeding is actually affected? Is his articulation affected? Is it just visually she doesn't like it, or like? But anyway, the surgery is really like, it takes 2 minutes. It's just like cutting a bit of, but you don't need to go through it unless the child really needs it, because there's general anesthesia and all of that, so might as well not to. So some of the milestones really quickly, but again, there's a QR code with all the information on it from the latest, most updated milestones that were issued maybe like a month and a half ago. And they were specifically issued post-COVID because COVID affected communication development a lot for kids. Now we're a bit more flexible with the milestone post-COVID, at least for COVID babies, okay? So you're gonna see that in the, because lack of exposure to communication, wearing masks, believe it or not, affected a lot. The social, pragmatic, all of that, like reading facial expressions, all of that. So they became a bit more flexible with COVID babies, but now on, like we don't have excuses, we go back to the older milestones. So that 2023. Well, yeah, but some parents also were busy working from home and did not really. It's this and that, but yeah. Okay, so just quickly, 12 to 18 months, usually the kids start saying their first words and they start following the first simple instructions. 18 to 24, this is where we start combining 2 words. So by 2 years old, we start combining 2 words and start understanding a bit more complex instructions and not just the normal daily routine, get your shoes, do this, that, a bit more complex instructions. By 2 to 3 years, the vocabulary continued to grow. We usually are up to 3-word sentences, Baba بدي روح, give me whatever, okay, so short, simple sentences. And they, yes, exactly, whatever it is. And then we start asking questions. This is the age where you're gonna be like, why, the whole day, okay? So it's a very interesting age, but this is where, they're growing that curiosity and that vocab growth that they have. 3 to 4 years, this is where they start speaking in sentences, understanding basic grammar rules, tenses, but they also confuse them. هي عم تاكل, هو عم تاكل, all that confusion, especially our bilingual and multilingual kids. And they start telling simple stories of things that happen with them in school, for example, in the nursery. 4 to 5 years, this is where they start engaging in back and forth conversations. Good luck, the conversation doesn't end now. And they start understanding more complex language, okay? Yes?
Is that 2 years
Better. First of all, what I usually recommend is go check an ENT. Just make sure that the hearing is okay. Okay, because if there's no input, usually it affects the output as well. Okay. The hearing is fine. You need to consult with a speech therapist, ideally. Okay, because we don't know till when they're gonna start developing, and we don't like the earlier the intervention is, the better it is.
Is it a sign of something, or maybe they're just?
It's not necessarily. It could be simple lack of stimulation. It could be a lot of reasons. So I'm not going to diagnose the child just yet, but better start with a consultation, that's for sure. Einstein was dyslexic and something else as well. But yeah, he did definitely had we were talking about the social pragmatic difficulties. But again, like this is where, because he was not focused on social communication, he was focused on something else because his brain was working in a different way. A lot of like the brainiacs of this world, like they had a lot of difficulties in social communication because their brain did not function the way our brain works. We have that advantage, but they have other advantages as well. Okay, I'm not going to go in a lot of details regarding the speech sound because I just want to compare the English speech sounds with the Arabic speech sounds coming in the slide after that. But just so you to know, that if a child is coming to me, they're, for example, I don't know, 3 years old, but they're still not pronouncing the je, sh, f, je, sh, r sounds, for example, we don't usually do speech therapy, but just make sure that the child is actually exposed to these sounds, okay? Not just like out of nowhere, we want them to be saying these sounds, and especially in Arabic. This is regarding the speech clarity when we were talking about the nanana, banana example, for example. So by 4 years old, you and a foreign listener should be able to understand what the child is saying up to 100%. Okay, we're making the difference because usually as parents or caregivers or teacher, we kind of understand what the child is saying by the age of 48 months. Okay, so these are the percentages. If you want to take a photo, feel free to do that. And 3, 2, 1. Yeah. Okay. This is the one I wanted to focus on really. And if you can see, it's black and white, and that's like after a lot of research, I managed to find that because unfortunately we don't study our Arabic language enough and the Arabic sound development and all of that. I even had to add some of the sounds according to another study because this one was even incomplete. Okay. But I just wanted to show you. Does that have a pointer? Okay, here, okay, at 4.5, one time I got a pointer and it turned out to be like the mouse thingy, and I was pointing and there was like a little mouse on the screen, and that wasn't the goal. It turned out to be for cats. Anyway, so you can see at 4, between 4 and 4.5, you have the ch and the sh sound, and then up you have s and sa and r and s and z and r as well. You have the ka, the th, the th and the and the. Okay, and then you have the r and ta and da. Just so I can show you that the Arabic sounds, the though is here. The Arabic sounds are usually acquired at a later stage. I get a lot of parents bringing their kids, they're 5, 6, ما بيقولوا ما بيقولوا خ ما بيقولوا ح. طيب بتحكوا معهم عربي؟ لا ما بنحكي معهم عربي. طيب وين بدهم يسمعوا الع والخ والح? Okay, so if they're not hearing these sounds, how do you expect them to discriminate them and to be able to say them? Okay, when kids are born, someone was talking about Maria Montessori and the kid being like a sponge. The kids are, they can absorb all the sounds of the word, and slowly the brain starts to specialize in only the sounds that I'm hearing. Okay, I will never be able, well, most probably I will never be able to speak Mandarin fluently because a lot of the sounds I've never been exposed to, I have no idea how to even produce them on a muscular level in my mouth, okay, on a motor level. So it's the same for kids who are not exposed to Arabic, and then suddenly we want them to speak Arabic when they're 6 and 7, okay? So start talking to your kids in Arabic, even if they're not answering you. For the people who are saying they don't answer me in Arabic, it's okay. They're still being exposed to Arabic from a young age. Now, in speech therapy, we have difference in between monolingual and bi and plurilingual kids. So according to the vocab, for example, monolingual kids, they develop larger vocab in single language. However, our kids, they develop the same total vocab, okay? So if we're adding the English and the Arabic and the Fusha and the dialect and, they actually have the same or even much larger vocab, okay? So that's why it's important when we're doing the speech therapy assessment to assess all the languages that the child is speaking before judging they have a speech delay or they have lack of vocab or whatever it is. Okay? Plus they have what we call contextual vocab. If they speak Arabic at home, they speak English in school. Usually the school-related vocab or terms are in English. The vocab of the house or the family vocab is usually in Arabic. Okay? Code switching, this is absent for monolingual speakers. Obviously, they don't have anything to switch with. But they might switch in different registers, so the formal and more formal and the slang and all of that. But we don't talk about really code switching. For our kids, we have natural code switching based on context, again, because we have higher metalinguistic skills. We spoke earlier, maybe you were not here yet, about metalinguistic skills and understanding the concept of the language as a language. What is it made of? What are the grammar rules, the tenses, and all of that monolingual children usually just don't think about. They're just like, I just speak the language. I don't know what مضارع مفعول به مفعول مستفعل. I don't even think about that. But we learn them because we're learning different languages.
I have a question. Like, is like plurilingual?
Yes.
Is
Plural.
Okay.
Yeah.
Is it a good thing? Because
Yes.
مثلاً أنا I find it really hard to maintain an entire conversation in just one language because كتير I resist the urge to switch يعني حتى لو it's just one word or two words بس خلص لازم يفوت بيناتهم English على عربي يعني.
So
إذا بس بدي أحكي جملة كاملة بالعربي أو بس تكون بالإنجليش عن جد it's torture for me.
Okay, so it depends why you're code switching or why you're switching from one language to another. Is it because of lack of mastering a language to a certain point that you feel like you need to switch to another language? Let's say you're talking to someone who does not speak Arabic. Okay, they just speak English. Do you also find it a torture to just speak to them in English, for example?
You know, I need to find the words, you know, like I need to focus a lot more when I'm just trying to maintain an entire conversation.
This is, first of all, a good workout for the brain, so don't worry about that. Two, it can be because, you know, English is also not your first language, so you might need to do a bigger effort to communicate in that language. But back to,
problem in Arabic.
again, because you know, one language can take some of the vocab of the other language. So, but back to the stuttering question, it's actually very interesting because a lot of the kids I see in the clinic that they stutter, they might use code switching as a, you know, escaping method or as a coping mechanism. If I'm starting to stutter in a certain language and I know the other person speaks in different languages, I will switch to another language just to kind of avoid blocking on the language. And what's even more interesting is that the relationship I have with that language is also very psychological. If I'm having, let's say, difficulties at home with my parents and everything, I tend to stutter more on the Arabic language, for example, versus if I'm being bullied in school or whatever it is, you start noticing more stuttering in English language, for example. Okay, but definitely in that case, it's an escaping method. It's not something to support in a way. We do let them communicate in whatever languages they're comfortable with, but we also try to see what's beyond that and what's underneath that. For the milestones, monolingual kids, they usually hit milestones within typical time frame, but we also talked about Arab kids or bilingual kids hitting the milestones slightly later. But again, if you add all the vocab they have from different languages, at the end of the day, the milestones are hit at a normal pace, even better than monolingual kids. The last couple of distinguishing factors, cognition and metalinguistics. So usually monolingual kids, they have average metalinguistic awareness. Bilingual kids, they have a much heightened metalinguistic awareness and advantage in problem solving, mental flexibility, anything that requires all of these skills, they have more advantage. Phonological skills, monolinguistic kids usually master phonological rules of a single language faster than bilingual kids. However, bilingual kids, they are exposed to at least 2 languages and they have 2 phonological system. When we're talking about the English phonological system versus the Arabic phonological system, for example, the development is slower, but then they can catch up and actually becomes better. I have a feeling you want a question. Phonology are the sounds, basically. Okay, so not the words, how, ta, and all of that, yes. And finally, social communication. Monolingual kids have one language for all social interactions. I don't even have to talk about bilingual. We talk a lot with everyone in every scenario, in every context. We have access to significantly more social communication opportunities. When to refer to speech therapy? So when we have linguistic concerns, language concerns, so limited vocab, usually by 1.5 years. Okay, this is usually just to keep an eye, okay? Why am I not developing any form of words by 18 months? Again, we start with an ENT checkup, okay? Just to make sure that the input is okay before we talk about the output. Not using simple sentences by 2, and difficulty following simple instructions by 2 years old as well. Feeding concerns, difficulty swallowing, feeding, drooling, even breastfeeding, okay? Gagging, coughing, choking during meals, taking a very long time to chew my meals. This might tell us that the motor muscles, the motor skills are delayed a little bit, okay? Voice concerns, persistent hoarseness or vocal strain. This is mostly for adults, but we see that with kids as well. And fluency concerns, answering the fluency and the stuttering question. Early signs in young children, persistent stuttering. Usually they tell you more than 6 months. I would usually say 3 to 6 months because the child is suffering in this time. We don't need to make them suffer a bit more. Like, wait until it's 6 months and then check a speech therapist. Might as well just consult whenever you feel like the stuttering is persisting, especially if there's a family history. Okay, because 70% of the cases are, genetical factors, and a lot of times the dad, the mom, someone from the extended family also stutters. Especially if the child is having negative emotional reactions to stuttering, we don't want them to suffer again. And if there's any parental concern, please do seek therapy. School-age children, this is when. Okay, so stuttering, usually the child, they start forming sentences 2, 3 years old. This is where we are still kind of exploring the language. It's okay to go through some, what we call them normal disfluencies. If that disfluency persists for more than 6 months, regardless of what the age is, we consult in speech therapy. Okay? For school, yeah. Mm-hmm. Mm-hmm.
Then you want to say something بس تحكي like is that stuttering ولا it's you know?
Okay, so stuttering can be stretching of the sound. Let's take the word mama, for example. So it will be mama. It can be blocking mama, and you will feel the tension. It can be repetition, which is mama, mama, mama. The that you're talking about, these are what we call filler words. It can be because of, how old is he? 7, and has it been always like this?
Yeah, I think he says mama, I mean, I'm paying attention. It's like he has to give himself a buffer.
Mm-hmm.
Like I think it's to organize his thoughts.
It can be to organize the thoughts. It can be the many languages that he's exposed to as well. It can be a personality. If someone is a bit too perfectionist, for example, they want to make sure that they're saying the correct thing the correct time. Because it takes a bit of the patience and the yeah.
Should I worry?
Is there anyone else in the family? We'll just return this into consultation. Anyone else? No, it's fine.
Advice to audiences: don't make it personal. Okay, I'll speak to you later.
We can talk after this, but I can also ask you some of the questions maybe other people would be interested in. Okay, if there's a family history, if there's any muscle tension, if he's talking about it and aware of it. So you see there's a lot of factors that will tell us, should you consult? If he's okay with it and he doesn't care and he's not even aware of it, don't consult a speech therapist, okay? I had people who were forced to go to therapy when they're 5, 6, 7, and they did like this huge blockage over therapy, and they came back. I had a person who was 26, and he only came back because he met a girl and he wanted to meet her parents, and suddenly there's the motivation to actually be fluent, and now he's interested in speech therapy, and now there's a reason why he needs to be doing speech therapy. Before, when you're forced, I always ask the kid, if they're aware of it, if they're comfortable with it. If they're not, we don't do speech therapy. We just work with parents as guidance and how to handle it and all of that.
I have a question. Is it normal for stuttering to go and come back?
Yes, it's very fluctuant, yes. Okay, stuttering by nature is very fluctuant. Okay. It depends on psychological reasons, it depends on the language they're using, it depends on...
When they're taking in a lot of input, like when we travel and then she gets exposed to a lot of Arabic,
change of routines, for example, because when they're traveling, there's no the regular routine of school. I wake up in the morning, I do the So during vacation, a lot of kids either stutter significantly more or the stuttering goes completely, because every child deals with vacation or like change of routine in a specific way.
Also, is breathing a form, like breathing in the middle of a word, a form of stuttering?
It's hard to say because it depends how they're formed. Like I need to hear it to tell you if there's tension in it, if there's eye contact avoidance in it, if there's, or just, you know,
She
a bit
says
too
the word,
excited.
but if you're not looking at her, you can't hear it because she's breathing while she's like moving her lips and continuing the sentence.
Okay. I do need to see that
Yeah,
to
okay.
understand a bit
Yeah.
more. But again, it depends on how much she's aware of it or not. If she's
not
doing
aware
it,
of it.
if she's doing it on purpose or
She's
ju-
not aware of it, and I never brought it to her attention.
then we have no issues.
Okay.
Okay. Benefits of early intervention. So obviously enhanced language development and communication skills, because the longer we wait, the more or the more severe the case is going to get. Okay, so might as well just start from the beginning. Improve academic outcomes. So many times we, that's 15, okay. So, because I was calculating the number of hands, okay. So improved academic outcomes. So many times we start with, let's say, simple articulation difficulty. The child is not able to discriminate between, I don't know, s and the, for example, and they say the for s. And then they start reading and writing, and then now they cannot even write the sound correctly if they're doing a dictation or imla or whatever, because they're not even hearing the difference between the s and the f or whatever it is. So to avoid any academic, you know, outcomes, we're not even talking about dyslexia and the more severe cases, better start as early as possible. And finally, prevention of behavioral and social emotional challenges, because if I'm not comfortable in the way I'm communicating, obviously my, you know, whole social emotional development is also going to be affected. Stigma around speech therapy. So unfortunately in our Arab world, we associate speech therapy to only when the child has significant disabilities or deficiencies. To avoid getting there, might as well start early, okay? Speech therapy is not just for extreme cases. It can be as simple as I have a lisp in the S sound that it takes 4 to 6 sessions and then it's gone, rather than it becoming a big deal, okay? We also have the belief that communication difficulties will resolve naturally. خاله حكوا بس كان عمره 7 سنين وابن خالته حكت بس كان عمره 4 سنين and all of that. That might be the case, but that might not be the case. So why do you want to wait until he's 6 to see if he's going to be like his uncles and speaking at 6 years old, or he's going to be 6 and he's going to be suffering all this time and after, and it's going to be harder to kind of close that gap at 6 years. And academically and socially and cognitively and all of the things we spoke about. Fear of being judged as bad parents. Rarely it's the parents' fault, okay? Parents definitely play a huge role in the development of their children's communication and everything, but there's a lot of genetical factors, there's a lot of neurological factors, there's a lot of factors, okay? And even if it's quote unquote because of you, we will not judge. We'll be happy that you finally brought them, rather than, oh, what are they gonna say, you know, is it my fault because I didn't talk to them enough, or was I busy, was I, okay? Judgment-free zone, please bring them as early as possible. Gender-based stigma, only in our Arab world. For some reason, the boy, we take them to therapy. Believe it or not, yes, girls don't come to therapy. I had that a lot. I had twins, both of them stutter. The boy is in therapy, the girl is not. Yes, believe it or not. Also, for some reason, we believe that the boys will it is kind of true, they do speak a bit later as a norm. We walk later because we have our hips and the balance and everything. Boys speak a bit later, but that does not mean that we can give them until 6 years old, like his uncle, to send them to therapy, okay? So we still have a lot of gender-based stigmas, believe it or not. Limited understanding of therapy's purposes. Why are they going to speech therapy? What is the speech therapist going to do to them? That also affects whether I send them or not to speech therapy. Fear of labeling. Here, this is a big, you know, topic that we need to talk about with schools. And once the child is labeled, inclusion, LSA, and everything, to kind of avoid going through all that, we just don't start the whole process, which obviously will lead to a lot of negative things. Consequences of stigmas: delay in seeking help, and even when they do end up seeking help, we have a reduced engagement with speech therapy, even after the referral, okay? Yalla, go to speech therapy, and then the driver will bring them back home, or okay, he's doing speech therapy, I'm paying you to do this and that. Can you see him every day for like the next 6 months and then bring him back to me normal? Yes, I do hear that a lot, okay? When you don't believe in what you're doing, when you don't know what the therapy is about, these are the type of comments that you're gonna make. That's why 90% of the cases, the parents are with me in the session, Okay, you're doing the therapy. I'm guiding you to do it because it's not something that I'm paid to do. It's something that you're here to learn and go apply it at home. I'm gonna see them once or twice a week for half an hour max. You're spending at least 8 to 9 hours a day with them, if not the time they spent in school. You're the person who's gonna be, handling and stimulating and all of that. And obviously it's gonna worsen the child's communication difficulties, well, for obvious reasons. Now, lastly, some strategies for addressing stigma, empowering parents through education and involvement. Education, this seminar and this summit is a big example of that. Thank you for doing that. Integrating speech therapy in early childhood programs. I started doing a lot of training for nurseries now, integrating as much as possible speech therapy, and at least just, detecting early signs of delays in the nursery so that we can handle things as early as possible. Focusing on the positive aspects of communication development. Communicating is not just, to have the perfect language, and communication is also to be, to have fun, to communicate, as simple as just interacting with someone else, engaging with someone else, rather than I have to speak perfectly, and that's why I'm in speech therapy. Providing culturally sensitive services, especially in our Arab world, we kind of have to. There's a lot to take into consideration in our Arab world, but religious factors are one of them, even political sometimes in Lebanon, believe it or not. Languages, all of that, we kind of have to customize the therapy for our kids. Engaging pediatricians and other healthcare professionals. Older pediatricians still don't really believe in speech therapy. We still hear that, leave them, it's okay, they'll talk when they're 4, when they're 5. No, okay? And with all due respect to doctors, we see the child more frequently for longer periods of time. The doctor might see them for 15 minutes, 20 minutes, and they're like, oh, give him a year and he'll talk. That's not always the case. So we do a lot of prevention as well with the healthcare professionals. And lastly, challenging all the misconceptions that we talked about and all the myths that we talked about.
Also in these cases, it's better to be safe than sorry. So it might just take
in all of the cases, it's better to be safe than sorry. Why? Why take the risk? Why wait? Why see what might happen, what might not happen eventually? Okay, so these are the developmental milestones. These are from the ASHA website, the American Speech and Hearing Association. They update them very frequently. And this is the latest update.
I have a question
Yes.
about the written, what is it called?
Written language?
Yeah, like written language. لأي عمر it's normal for them to flip the word, like for example, writing in English from right to left.
To be fair, this is not my area of specialty. I don't work in written language, but again, it depends whether the child is monolingual or bilingual, because we write in Arabic from right to left, left to right in English. So it's normal to go through a phase of switching. The first, I would say, couple of years of learning to write, and then after that, we need to check usually with an occupational therapist rather than a speech therapist, because it's more about the attention and eye-hand visual coordination and all of that.
Okay. Thank you.
Yes.
If you stutter,
Yes.
do you write it in a stuttering?
No. No. It's just verbal. It's a verbal communication disorder. Very. Okay. The survey that Rima told us about, don't forget to scan it. There you go. But anyway, everyone scanned the one before? I don't need to go back to that, right? Okay, so I'm just going to leave you at this, and I think we have maybe 6 minutes for anyone who needs to ask any kind of questions. خلصتيهم كلهم؟ طيب يلا ماشي. Thank you so much. Thank you so much.
Okay, I have
Yes.
a question, but I think the answer is no, it's sensory. Last year, بس إنه only بالوقت السنة الدراسية يعني in summer it was gone completely, but during the السنة الدراسية, my daughter would just be sitting and watching TV, which is only half an hour a day, and she'd be and I'm like, what's going on?
What is she watching? That's the first question.
No, she watches things that are way.
And how old is she?
She was 6. At that
Okay.
time, so she's
Was she
7 now.
practicing her sounds? Was she going through a phase
don't
of
know,
reading,
sometimes-
writing them?
She was learning to read and write for the first time, because قبل we were in Denmark, so ما كانت أصلا حتى she learned يعني حتى letters.
Yeah.
So grade 1 يعني اجت لهون grade 1 وبلشت تدج
Yeah,
كل
yeah,
شيء.
yeah.
بس ما بعرف إذا this is why بس إنه sometimes حتى in the middle of the sentence إذا بتوقف يعني بتوقف in the middle of the sentence to make and then بتكفي and I'm like شو عم بيصير. So we ignored it for a while and then we started to tell her like انتبهي إنه ما بقى تقوليها. And then we're like, okay, لا, it's not working. And I asked a few people, بس ما بتذكر مين كانوا يعني ما بعرف إذا إنه حدا خصه بسبيتش. I don't think it was in speech therapy. So they're like, it will go away لحالها. No, don't.
ما خصهم بspeech then. Like no, because I cannot just tell you it will go away without understanding the context.
Therapist, I think, and someone else. They're like, it will go
Okay,
away.
okay. Did it go away? One?
It went away during the summer. بس هلا لما بلشت المدرسة دي كل يوم عم تلعب على الآيباد وشير this, so she started to like تعمل تززق وبرو.
Okay, try to talk to her about it.
Yeah.
Okay, try to understand what is she thinking about while, like sometimes, we're doing a very boring task or whatever, like I'm نعمل الجلي and then you'll be thinking about the summit or whatever it is, and you'll find yourself talking to yourself or whatever. 6 years old, she's aware. You can talk to her, you can ask her, but don't block it, okay? Because you want her to always feel comfortable. Don't block it, as in don't ask her to stop.
Yeah,
okay. Let her feel free to interact and communicate the way she wants, but do have that conversation with her and see what she tells you.
هلا كتير أخف.
But ما تحسسيها إنه what the hell are you doing kind of like attitude أنا عم بسمعك بس إنه شو عم تعملي إنه this is very be very open and just like try to see what she's thinking about. Yes, someone raised their hand. Yes.
So speech therapists also work on like the muscles of the mouth because like you said they'll grow out of it. So
I never said they'll grow out of it. I said don't say they'll grow out of it. Yeah, yeah, yeah.
Now I took my son to a speech therapist, but I'm not sure how much I trust their opinion where I live. So she said he doesn't.
How old?
When your son talks and he's like بيحكي يعني إنه there's just so much
Drooling. Yeah.
Like, he's gonna drool.
Yeah.
He's cute now.
Yeah. How old
But
is he?
He's just turned 6. But I mean, when he's older and doing that, it's gonna be cute.
Okay.
She said no, he's fine because she was speaking more language. But what about that?
No, I wouldn't even consider the language because that's not what you're here for. So you usually assess the muscles. So you assess his cheeks, his tongue, his lips, the lip closure, all of that. You'd also assess his nose because sometimes if the nose is blocked, I need to open my mouth to breathe. And then when I open my mouth, the tongue is more relaxed, and then there's drooling, just like when you're a bit sick and you feel like, and you're drooling. Okay, so you need to assess on a more medical perspective one, and if there's nothing medical, then you can do some exercises to kind of strengthen the muscles of the mouth and all of that. No, medical through an ENT, just to make sure that there's nothing blocking that this area, the ears, the nose, everything, and that then he's able to swallow normally, breathing normally, everything. And then if there's nothing there, then you go back to speech therapy. But again, it depends how abundant the saliva is and how severe it is, and is it affecting him, is it affecting his communication, articulation, his feeding. So we then take the decision whether it's an urgency or just do these exercises for 3 months and then come back if you need to. Yeah. If you're not comfortable, always get a second opinion.
I love what you said about stutters that can come and go, and like this idea that it's very linked to like emotional well-being, and if routine is changed, then that could come back and trigger it. How much do you guys provide مثلا emotional therapy in conjunction with speech therapy? Because I have heard of stuttering in stressful situations, for example, coming back and
So let me just tell you a little bit about stuttering. Stuttering is not usually caused because of a psychological factor, but it's triggered by a psychological factor. So usually it's either genetical, neurological, it could be a lot of cases, but not psychological factors. But once it exists, when you have prerequisites to having stuttering, any psychological, traumatic or not even traumatic can trigger it. And then you can start experiencing stuttering incidents, let's call them, okay? What we do in therapy, we have what we call the stuttering iceberg, okay? So there's like the iceberg, there's a part that you can see on top of the water, which is like the visual, let's say, the tension, the eye contact avoidance, the things that you hear, the tension, the repetition, the stretching, everything that we talked about. And there's the part that is under the water, and this is where we're talking about avoidance, shame, not presenting anymore. I have a lot of kids who would go to a restaurant and they want to order, for example, I was going to say Pepsi, but now we're going to say Alokozai. No, we're going to say Alokozai cola, and they would switch it to something completely different. They would order water because they felt that they might block on that word. So all of these things are under the water that we also target and work on, because one influences the other. If I'm avoiding, I'm stuttering more. If I'm stuttering, I'm going to feel more shame. I'm going to feel more sadness, anxiety, whatever it is. So they both affect each other. So the under the water part, the psychological part, it is something very important that we work on. And in some cases, it depends whether the reasons are more linguistic or purely psychological. We then refer to psychology if there's like, I don't know, fear of performance, there's any kind of separation anxiety, whatever it is that is really triggering the stuttering, then we work alongside a psychologist as well.
I have a question. It's not that someone else has another question, because I asked way too many.
It's okay.
Okay. For example, if the stuttering came as a result of a severe, like a fright or a trauma.
Yeah.
And then this
Or an
person
explosion or whatever it is.
Exactly.
Yeah.
And then this person grew up, and now he's a father of 2 kids.
Yeah.
But he still stutters, and it bothers him. Can he get treated now as a 30-year-old?
So we don't really talk about treatment because it's not a disease that
Yeah.
you take medication to treat, but we talk about, like, for example, learning fluency techniques, learning how to cope with it, learning, especially if it's something that has persisted for that long. It's not something that might just go away, but it's something that you can control. It's something that you can learn how to reduce. It's something that you start understanding, and when you understand it more, you are less worried about it, and thus it shows less.
Not too late.
It's never too late.
because عن جد
Especially if
bothered.
they're bothered by it. It's never too
He's
late.
very bothered by it. يعني بيكون بده يبلش الجملة بيصير بيعمل هيك إنه إنه
Yeah.
بعصب
Yeah,
إنه
yeah, no,
I want to
definitely.
get it out.
Definitely. I worked a lot on adult stuttering cases, even more than kids, because adults are more aware. They actively seek speech therapy more than kids and their parents. All right, time is up. I'm done. Okay. Thank you so much. Thank you. I hope. Of course. Of course. Thank you for coming today, and thank you for staying all this time.